exposed. So all the people that work at these places, all these hotels, all these union workers, let's make sure and protect them and also thank them every day for risking their lives, because they're the ones to earn a living have to be out there dealing with the public. So it's very critical.
Well put. Well, let's just do an air handshake here, and thank you as always, Commissioner. We'll let you get back to work.
And I love your mask.
Thank you, Commissioner. That wraps up this edition of In Your Neighborhood. Thanks to our good friends at Caesars Entertainment for hosting us here at the legendary Caesars Palace, and to Commissioner Tick Sagerblum for taking time to tell us about the area he calls home and represents as your elected official in District E. If you have any questions about this show or ideas for upcoming segments in your neighborhood, call me. I'm at 702-455-6357, or send off an email to rsw@clarkcountynv.gov. Thanks for tuning in to Clark County Television. On behalf of our production staff, I'm Randy Swallow. We'll see you again next time in your neighborhood.
As Las Vegas gets on the road to recovery from COVID-19, we still need to work together to fight the virus. With no vaccine, COVID-19 continues to be a public health threat. The best way to protect yourself and others is to keep practicing these important measures. Wash your hands often, clean and disinfect frequently touched items, wear a face covering in public places, and continue to put social distance between yourself and others as possible, whether you feel sick or not. Keep up the good work, Nevada. We're in this together, and we'll get through it together. Stay safe, stay open.
Don't let your pets go tomcatting around. Did you know that an unspayed cat, her mate, and all their kitties can produce 470,000 cats in 7 years? Prevent a litter. Fix your critter.
Our community, our home, Clark County, Nevada. Thanks for watching Clark County Television, the best access to your local government.
Coming up next on the UMC Digest, find out how to protect your family in the best ways from COVID. Also, we'll take you inside the UMC laboratory where we do thousands of COVID tests every single day. The UMC Digest starts right now. Welcome to the UMC Digest. I'm Danita Cohen, the Chief Experience Officer at UMC, and today I am joined by Dr. Medina, our infectious disease physician, so we can have a conversation about COVID, where we stand now, and how to best protect our families. Hi, Dr. Medina. Thank you for joining us. Good morning. You're on the front lines every single day. What are you seeing currently? Obviously a spike in cases, right?
We certainly have seen that. Part of that was a result of the increased ability to do more tests, but we've definitely seen a trend of more infections over the what we call the 7-day rolling average. So this is something that we do need to worry about and that intervene right now by trying to prevent the spread of infection and hopefully keep us safer.
Do you find that the symptoms of COVID are changing and have changed over the months that you've been, dealing with this virus?
So as time goes by, more knowledge is available to us. And at the beginning of the epidemic, the symptoms that we focused on were essentially those that were influenza-like, like fever or muscle aches or cough sometimes. But now we've known that there's so many other types of symptoms, like the loss of sense of taste or smell, headaches, diarrhea, and gastrointestinal symptoms that can also be associated with COVID. So it's a little bit more difficult to establish that syndrome or that set of symptoms that are particular with the disease process. So right now, we ask people that if they feel sick overall, just to stay home, and if they don't get better soon, then to get tested and seek medical attention.
And is that sort of the tipping point? If you stay home for a few days and still don't feel well, go get tested. What's the tipping point? Because a lot of us want to know, when should I go get tested?
So the first thing is, if you have an exposure to someone who is known to have COVID, then you should definitely get tested. And the best time to do that is about from day 3 to day 5 after the exposure. The reason for that is, there's an incubation period where the virus starts to make more copies of itself and establishes the infection. And if you test too early, you may have a negative test, not because it's a false negative, but because it was too early in that incubation period. So you want to give it enough time to find out if you did become infected or not. And that's usually the 5-day target.
Okay, so 3 to 5 days after you've been around somebody.
After being exposed. If you start having symptoms like fever or cough or shortness of breath, you could potentially get tested earlier, because by the time you develop symptoms, you should have detectable virus in the nasal mucosa or the oropharynx, which is where we do the swab. So symptomatic patients can be tested before then. If you do develop COVID and you don't have significant symptoms, you could stay at home and just take care of yourself. But if at any point you run into problems with shortness of breath, some of these patients feel otherwise fine, but then start doing minimal activity like going to the bathroom and suddenly they're winded, then that's definitely a time to see a doctor about it, because you may need to have an x-ray done and have your oxygen levels checked, and then potentially get treatment for it.
So the shortness of breath is one of the keys. Don't mess around with that.
Oh, definitely. If you feel like you're, not getting enough air in there, that's time to see a doctor right away.
And the other symptoms that you mentioned, the stomach issues and the headache, typical over-the-counter medications, treat with that just for the symptoms?
Yeah, so Tylenol is probably your best bet if you're having a headache. The diarrhea is self-limiting, so it goes away by itself. Anytime you have diarrhea, if you have any blood or mucus, or it just does not look like regular diarrhea, then you should see a doctor about it as well. But there's not something specific medication-wise that you should get if you're going to take care of yourself at home. Certainly stay hydrated. That's going to help both the headache and the diarrhea if you get it. But if you get that feeling that something's not right, go get checked out. And hospitals are open and available to take care of you and diagnose you and treat you if need be.
You can also go to our website, by the way, at umcsn.com and check out the COVID-19 testing center. We do have several testing locations across the community. There's a drive-through location at Thomas and Mack on the UNLV campus and another at Texas Station. We do ask, of course, that you have an appointment so that we can see you in a most efficient way. So just again, log on to our website, umcsn.com, and click on the COVID-19 testing center. What about kids? Should kids be tested at this time?
So a month and a half ago, I think, we opened pediatric testing at the community-based test sites. And the main reason for that was we need to collect data. There's very little information about COVID in children as compared to the adult population. And we have seen, of course, kids that do get COVID, but for the most part, they're relatively protected. And there's many theories behind why that may be the case. Sometimes they say that the kids don't have the ACE2 receptor in the lungs to which the virus binds developed enough to establish an infection. Their immune systems may be a little bit less developed. So those are all things that can be protective for them, but they can become sick. One of the things that is in the literature currently and that is being studied is whether children are super spreaders, so to speak, like they are with influenza, and it seems that that's not the case. And that may have implications for policy making, schools, etc. But there's still much more to know before these decisions can be made based on the current information that's available.
With the tests that we're doing now, what's the percent of positives that you're seeing? Because that's definitely increased.
For just the general population?
For the general population.
So at the beginning of the epidemic, I think we were around 12%. And then with the stay-at-home measures and mask wearing and everything else, it came down to about 5% or so. If I recall correctly, the latest numbers are around 8%. But it's certainly going up. So.
It certainly is. And we're doing over 5,000 tests a day now just at UMC alone. We have a second lab that we built, a brand new lab that we built just for COVID testing. And we're actually going to take you inside that lab and meet our director, Lisa Gorlick.
We're standing in the largest COVID-19 testing laboratory in Nevada. I'm very proud of the fact that Nevada, as a result of this laboratory, is one of the states that is not just testing symptomatic individuals. We're actually testing asymptomatic individuals, along with obviously symptomatic individuals. This area was originally a physical therapy rehab department, and within 3 weeks, with the help of a lot of people, it was transformed into the laboratory that we're in today. We started ramping up from 100 tests a day that met UMC's needs. Then we've been ramping up gradually. We went to about 500 tests a day and then 1,000 tests a day. The beginning of May, we went to 5,000 tests a day, and then the beginning of June, we went to 10,000 tests a day. So it's changed dramatically. We're testing every patient that's admitted into the hospital, and we're proud that we're able to produce those results in a very quick turnaround time. So if you are admitted to the hospital, or you are suspected, you're at the hospital and suspected of having or potentially having COVID-19, you are tested on with that time frame in mind. It makes UMC a much, much safer place for everybody, the employees. I mean, identifying who's positive makes all the difference in the world, because we can then make sure that we're handling everybody in the proper way. Even our outpatient surgeries are tested for COVID-19 before they come into the hospital. So this makes UMC a much safer place to be a patient and to be an employee. If you are registered for a COVID-19 PCR test at one of our drive-through testing locations, you're already registered in our computer system for the hospital. And whenever your specimen arrives in the laboratory, it already has a barcode and a label on it. So we can bring those into the laboratory very quickly. It's run through the testing process. It's resulted in the computer system that's interfaced with the hospital computer system, and the patient can get real-time results through the UMC Connect portal. And literally, when we result the test in the laboratory, it moves directly to that portal and makes it available for the patients to see. PCR test indicates that the patient is positive and is shedding the virus. The antibody test indicates past exposure or previous exposure of some kind. And if you develop antibodies to the test, then we know that at one point that you had the virus and might have been asymptomatic. And a lot of people are very interested in that because they believe they may have had it at one point, but didn't really have a lot of symptoms. And so this is an opportunity, if they had the antibody test, to determine whether they have had previous exposure. If you can identify the individuals who are positive, then you can take special precautions with that group. In addition to that, the epidemiology piece of this is very important. Where that person has been, who they've been in contact with, have they been to see their elderly grandmother, have they been, playing with their grandchildren, and how those individuals have interacted with other people. So it allows a positive person through the epidemiology process to find out exactly who they've been in contact with, who might be positive as well. And that really helps us determine and slow the spread of the virus. UMC is Las Vegas. And that's really what it says, because nobody has stepped up to the level that we have and pulled out all the stops in order to make something like this happen. And I think that makes UMC Las Vegas.
How many more of these are we gonna have to see?
Do you like it?
There's no time for downtime.
She doesn't.
Better get better, quick. UMC Quick Care has locations all across the valley, and you never need an appointment. So get in and get better. UMC Quick Care.
Let's see a couple more.
There's no time for downtime. Better get better, quick. UMC Quick Care has locations all across the valley, and you never need an appointment. So get in and get better. UMC Quick Care.
Mom, we're out of cereal. Can I go to Jennifer's tonight? No, you said you were going to take me to dance.
There's no time for downtime. Better get better, quick. UMC Quick Care has 8 locations, and you never need an appointment. So get in and get better. UMC Quick Care.
Mom!
Find a dock in my neighborhood.
The nearest dock is the Port of Long Beach, 284 miles away.
Find a dock. Doc!
Calling Doug.
Finding a family doctor in your neighborhood is as easy as visiting a UMC Primary Care. Locations valley-wide, there's one near you.
Find nearest Thai food.
Typhoons occur in the North Pacific Ocean.
Welcome back to UMC Digest, talking about COVID-19 here in our community and how you can best protect yourselves. And one of the best ways, of course, is by wearing a mask, now mandatory here in the state of Nevada. Dr. Medina joins us from UMC. He's our infectious disease physician. Thank you for staying with us. We appreciate it. What's the difference, one mask between another?
And that's to prevent the spread of the disease. This is primarily a disease that is spread by droplets, which are very small, bubbles of saliva that come out of our mouths when we sneeze, cough, or even speak. So by wearing a mask, you contain your respiratory secretions, and if you were to be infected, then those bubbles of saliva aren't in the air for somebody else to get infected. So that's number one. And then I'd like to divide the mask categories in 3 main ones. So those that are made of cloth, and those are the ones that are meant for the community at large. You can make these from any kind of fabric. There's YouTube videos on how to make masks or face coverings from old t-shirts and such. And that's what the general population needs. Then you have medical grade masks, which are surgical masks like the one we're wearing now because we're healthcare workers. And then there's respirators. And those are specialized masks for high-risk procedures. When we talk about droplets, these little bubbles of saliva, they're fairly large. They're still invisible to the naked eye, but they usually fall to the ground due to the effects of gravity. And aerosols, which are much, much smaller than that, they tend to be suspended in the air. So that's the role of the N95 masks or the respirators, which are reserved for